This activity came with the help of EPI, Expanded Program on Immunization, to follow defaulters that are at homes, at the streets, that were not coming for immunizations. So these defaulters, most of them were default because one, they may not know the importance of immunization. Two, because of accessibility, our facility is far from the people. Most of them feel like the distance is far, so they are not coming. And the third and the most important thing is the COVID-19. The time of the outbreak, most of the people distance themselves from the facility because they believe that when they get to the facility, they will have COVID-19 or they will be tested with COVID-19. That stops most of them from going to attend immunization services. So the time EPI came up with this default tracing, so since on Monday we were going to the communities. We started at Bakau, Bantaba, down towards the cinema, to Mamakoto, to the Newtown Mosque, Newtown. Now today we are at the Fajara Barracks because all these communities I mentioned are part of Bakau Health Center catchment area. So the default tracing we are doing in this way. We go into the communities. We have a point where we will sit, and we have 2 or 3 individuals that will mobile, that will go around house to house sensitizing people about the activity, and people will come and meet us, and we will go through their IWC cards, and we will screen those that are defaults who will be given their immunization shots. Most of them will be having only their vitamin and mebendazole, which we give every 6 months, which are very important. And what we realized too is like most of the parents, they don't know the importance of immunization, or they don't know the message towards immunization is lacking. So we try to communicate with them. Most of them believe that after 1 year, 6 months, that is the last sort of injection they have, the child should not be coming for immunizations. So we try to disseminate this information to them. All children that are on the 5 should be attending immunization schedules. Even though they are not getting injections, but they are having very, very important tablets that we are giving, mebendazole, warm tablets. We are also giving vitamin A, which prevent them from night blindness and other disease conditions. So all those things are important when it comes to immunization. And COVID-19 and immunizations, since the start of COVID, we have seen a huge number of mothers that are not coming for immunizations. If you go through our birth registrations, we will see a lot of defaulters that were not coming since the start of immunizations. We were receiving a lot of home deliveries at the homes because of the fear that when they get to the facility, they will have this COVID-19, or when they get to the facility, they will be tested with COVID-19. And the start of this defaulter tracing, this activity we are doing right now, we also sensitize the women that there is no COVID vaccine yet in this country. Gambia did not have any COVID vaccine, because some of the time, if you tell people, can you go to the immunization schedule for your shot, they'll be like, if I get there, they will give me the COVID-19. We want to make this clear to all those that are listening, that Gambia, at this moment, we don't have any COVID-19 vaccine in the country. The same vaccines we have, the vaccines like tuberculosis, BCG, for tuberculosis, vaccines like hepatitis B, vaccines like Penta that we immunize against disease conditions like hepatitis B, diphtheria, pertussis, human influenza type B. Vaccines like pneumonia, pneumococcal vaccines. It's the same vaccines we are given at the immunization schedules. There is no vaccines for COVID-19. So even this defaulter tracing, you will see some people will come and say, is this a COVID vaccine? We will make it clear to them, this is not a COVID vaccine. Gambia is yet to have a COVID vaccine, but what we are given is the same vaccines we are given at our immunization table. Anytime there is a COVID vaccine, the entire population of the country will know that there is a COVID vaccine which is safe for the Gambian people. But currently we don't have COVID vaccines. The only vaccine we are given is the normal routine vaccines that we have in our settings, that we have been given in 3-4 years back, the same vaccines we are giving to our people. So we don't have COVID vaccine, and we want to make this information very clear to the people that we need to make our immunization schedules seriously. We need to be serious with them, because what happened, people are just scared of COVID, but without knowing that there are other disease conditions that are far worse than COVID-19. We are immunizing more than 13 disease conditions. all these disease conditions are capable of causing outbreaks in our community. So if we are sitting at home because of only COVID-19, only one disease conditions, what if we have outbreaks of all those 13 vaccine preventable diseases? May God forbid if that happened, that would be another disaster. I will urge all parents that are at home, let us not leave immunization schedules for only the mothers. Fathers also need to be involved. That's why it is called outreach, reproductive and child health. When you say reproductive, it doesn't matter whether you are a male or a female. All should be included on it. So we are urging fathers to be involved in outreach services to make sure that all the children are having their shots. We would love to see all those that are defaulters to come and take their shots, and not only defaulters, the message you pass to them, even after today, make sure that you come for your weighing, your mebendazole and your vitamins so that you can protect your child from these disease conditions. So on the final note, I will thank all of you, and special thanks to Bakau Media for coming. And since we started this, they have been passing the information. The start of it, though they were not informed, but since they knew that we are going for this defaulter tracing, because of the importance of it, they published on their page, and we really appreciate it. Thank you very much.